Hall cured his leukemia with cold water swimming. He cured his lymphoma with forest bathing. And if forest bathing has all of these tremendous benefits, including improved mood and faster wound healing, is it really just the phytoncides? I don't think so. I think it's the light environment. And of course, the forests are green. There is something about, in my view, the way the human body is organized that is meant to live in the shady forest, or meant at least to seek refuge in the shady forest. When we're, I don't know, spotting the predator who's stalking us. I'm imagining some ancient ancestor, 10,000 years ago prior to civilization. Where would our ancestors seek safety? Might it be in the trees of the shady forest? There could be a deep-rooted psychological, physiological link between, of course, our light environment and our psychology, our feeling of safety and security, and our reduction in anxiety when we're in the shady forest. All of these things promote healing. All of these things boost the immune system. When we're talking about the psychology of the patient, anxiety is one of the worst things for the patient's recovery. Relieving that anxiety, lifting that mood, reducing the inflammation. These are typically promoting the patient's healing. And there's some good studies on the color green. Some of these studies come out of hospitals where a patient with a window, of course, heals faster than a patient in a room without a window. But if that window has trees in view, the healing is even faster than that. There's one study of children in a dentist's office. Autistic children in particular are very difficult for dentists to work on because they're on a constant level of anxiety, like a hair trigger sympathetic nervous system that will tip them over into fight or flight. But when the dentist office in this one clinical trial was lit with green, the autistic children calmed down. They were better prepared, better behaviors that allowed the dentist to complete the cleaning or whatever the dental procedure was going to be. And it's not just autistic kids. Even just a picture of a green mural on the dentist's wall will result in lower subjective pain scores reported by the dental patients. There is something about the color green that is very comforting to human psychology, and I believe it is a physiological link between the eye, the optic nerve, and the brain that results in these psychological benefits that feed back into physiological state of health. That's not a biologist or a neurologist's explanation. I don't work inside the body. You know I'm an engineer. I build machines. And the machines that I build are supposed to take you closer to nature. Living in Phoenix, Arizona, I'm at least 2.5 hours drive from the shady forest. There is no cold water where I live. I teach at Arizona State University. It's the hottest city in North America here. This is why I have Morosco on my balcony. I've got my ice bath so I can get cold whenever I like, and I do it every day. But what am I going to do about the shady forest? What am I going to do for my green light? And green is the wavelength that nowhere near enough people are talking about. You know about red light. You know about red light because you follow a lot of the same people that I do. You listen to the podcasts. You probably read many of the articles, and you probably have a red light just like I do. And you know that people in modern society are under a chronic deficit of red that they can make up for with a red light device. But have you really thought about green?